So the WHO collaborating centers are a very essential and cost-effective collaboration and cooperation mechanism, which actually allows the organization to fulfill its mandated activities and to harness resources globally, far exceeding the staff strength of the organization. So WHO gets access to leading universities, hospitals, research institutions to receive strategic support for implementation of the organization's mandated work and programs. And you will find that many WHO technical programs at all levels of the organization use this mechanism of collaboration. And in some instances, it's really become quite an essential part of the delivery of some of our work products. For example, I can give you the example of the development of the ICD-11, which is International Classification of Diseases. Or another example is on surveillance and the development of seasonal vaccines for influenza. These are only possible because of the network of collaborating centers that are contributing to these areas of work. And as of 2021, WHO had over 800 collaborating centers in over 80 member states. Yes, so I can give you a couple of examples. Children's environmental health. We have 8 collaborating centers, and they have been absolutely essential both on conducting the necessary research and providing the evidence to inform our work. There were many centers, for example, who contributed to WHO's initiative on preventing e-waste exposure, because we know much of the e-waste ends up in developing countries, and it's often handled by children, and it really compromises their health because of exposure to multiple toxins. So these collaborating centers have been quite critical in supporting us in collecting data, in developing background documents, including doing a systematic review on e-waste and health. The network has also supported WHO's capacity building efforts in this area by developing and reviewing training materials for doctors and nurses. And WHO was the first, is going to issue very soon the first publication on e-waste and child health. And this has really benefited from the expertise of the network of collaborating centers. Another example is a global network of WHO collaborating centers for bioethics. This was established in 2009 and comprises about approximately 12 collaborating centers from all the regions. Half of them are in low and middle income countries. And they help in supporting the work on ethics in public health programs, but also research ethics. The scientific validity of WHO's work on bioethics is really enhanced by collaboration and dialogue with these academics centers. And so we really work with them to achieve enhanced results, to facilitate resource mobilization, and to strengthen institutional capacity at the national level. And these global networks have come up with several products, including publications on human genome editing. They have helped in developing the ethics guidelines for public health surveillance, but also a recent guideline on artificial intelligence and big data. And then finally, over the last 2 years, many collaborating centers have contributed to the fight against COVID by supporting a number of different expert groups that WHO runs, as well as contributing to many of the documents, the SOPs, and the guidance guidelines that have been produced. So we can strengthen this relationship further between WHO and the collaborating centers by really taking a more strategic approach, by identifying very clearly and working together to identify what those priorities are of the department that the collaborating centers will be contributing to, and then really working as partners in trying to achieve the shared goals. We would also like to see many more collaborating centers coming up in low and middle income countries and becoming part of these networks, because that will also build the capacity and bring the valuable experience that people in LMICs have into the global network. Another approach is to really move away from bilateral relationships with a single collaborating center to really getting into networks. I described the network we have for influenza, we have a network for bioethics, and we have another networks on nursing and midwifery collaborating centers. These networks are actually functioning really well because they all are interested in the same topic, and they work with WHO generally in producing documents, in undertaking training programs, but also in research. And so there are some other products that we're working on, including framework for mental health and psychosocial support in emergencies. The collaborating centers also sometimes help. In fact, they help a lot in disseminating our publications and our guidance, sometimes by helping translating, but also by running training programs and in being the sort of amplifying the voice of WHO in their own countries and regions.